Let's now discuss kidney 4, the great bell point, a Luo-Connecting point. So kidney 4 is located anterior to the medial border of the Achilles tendon, superior to the insertion of the calcaneus. How to find kidney 4? From the highest prominence of the medial malleolus, draw a horizontal line to the medial border of the Achilles tendon. From there, measure 0.5 tune in a distal direction. Kidney 4 is located in a depression anterior to the Achilles tendon, slightly superior to its insertion at the calcaneus. Or kidney 4 is located posterior to the midpoint of a line connecting kidney 3 and kidney 5, anterior to the Achilles tendon. Kidney 4 is needled vertically 0.3 to 0.5 tune. Avoid puncturing the tendons. For its actions and indications, kidney 4, it helps the kidney absorb the qi and supports the lungs. It strengthens the kidneys and cools empty feet. It strengthens the will and dispels fear. It is also a local point. For its special feature, kidney 4 is a Luo-Connecting point. Being the connecting point, kidney 4 connects with the bladder channel and is therefore useful to treat chronic backache or kidney deficiency. It is often used in conjunction with the governing vessel as follows. These points are used in a man. So kidney 4 in conjunction with SI3 on the left and bladder 62 on the right, or with heart 7 on the right and kidney 4 on the left. Kidney 4, in common with other yin connecting points, also has a marked effect on the mind and can be used both to calm the mind and to lift the spirit when the person is exhausted and depressed from a chronic kidney deficiency. So, to emphasize, kidney 4 strengthens the kidneys receiving qi. It's good for cough, coughing of blood, wheezing, breathlessness, rattling sound in throat, a feeling of oppression of the chest. It also calms the mind and lifts the mind and is good for palpitations, agitation, mental retardation, manic behavior, propensity to anger, somnolence, fright, unhappiness, desire to close doors and remain at home. It also benefits urination in cases of difficult urination, dribbling urine, and retention of urine. And it strengthens the back for lower back ache. Kidney 4, the Luo-Connecting point of the kidney channel, regulates the kidney functions in two main ways. Firstly, it reinforces and regulates the relationship between the kidneys and the lung. And secondly, it has a strong effect on stabilizing the emotions. According to the complete works of Qing Yue, the lung is the master of the qi. The kidneys are the root of qi. The lung dominates exhalation of qi, while the kidney dominates the reception of qi. Only when yin and yang are mutually communicating is respiration in harmony. In discussing the dyspnea, the case history from the Guide to Clinical Patterns by Yi Tian-Shi states that when it is in the lungs, it is excess. When in the kidneys, it is deficient. This latter statement, although something of an oversimplification, nevertheless emphasizes that when a respiratory disorder is acute and of excess type, it is the lung that must be emphasized in treatment. And when it is chronic and deficient in nature, treatment of the kidneys takes priority. In its action on harmonizing the relationship between the lungs and the kidneys, kidney 4 is indicated when the kidney chi is insufficient to receive and anchor the chi from the lungs, resulting in coughing, wheezing, asthma, shortness of breath, etc. Or when kidney yin is deficient and unable to moisten it and cool the lung, mouth, and throat, resulting in wheezing, coughing of blood, dry and painful throat, and others. Both these situations are referred to as excess above and deficiency below. Compared to kidney 3, kidney 4 has a relatively stronger effect on addressing the fullness above and a lesser action on nourishing the kidneys. In common with many of the Luo-Connecting points, kidney 4 has a strong action on the emotions. According to the spiritual pivot, deficiency of qi in the kidney channel of Fu Xiao Yin may give rise to susceptibility to fear. When the kidney qi is not animated, the will is deficient and the person easily suffers from fear and lack of confidence, which may be so severe that they withdraw and are unwilling to or unable to leave the safety of their home. When congenital essence is deficient or essence is consumed in old age, there may be susceptibility to fearfulness, poor mental functions or development, and a decline of mental faculties. Susceptibility to fear may not only be due to deficiency of the kidneys, especially kidney essence, but also to feebleness and deficiency of qi and blood, which fail to nourish and support the spirit, or to deficiency of the liver and gallbladder. Kidney 4, an essential point in the treatment of fear due to kidney deficiency, also plays an important role in the treatment of any of these patterns because of close relationship of the kidneys to fear. Severe excessive desire to sleep may result either from spleen deficiency with accumulation of phlegm in dampness or from kidney yang or kidney essence deficiency. Kidney 4 is an important point for somnolence due to kidney deficiency. The kidney Luo-Connecting channel rises from kidney 4 to the lumbar spine, accentuating the close relationship of the kidneys in this region, and this point is therefore indicated for stiffness and pain of the lumbar region. Like kidney 3, kidney 4 is also used for heel pain. Finally, the Great Compendium of Acupuncture and Moxibustion gives specific indications for excess and deficiency of the Luo-Connecting points. In the case of kidney 4, these are retention of urine for excess and lumbar pain in deficiency.